Welcome to my M&E Primer, an online training on monitoring and evaluation brought to you by Management Sciences for Health through the Building Local Capacity for Delivering of HIV Services in Southern Africa project, or BLC. Southern Africa has been the epicenter of the global AIDS epidemic. The BLC project builds the capacity of governments and civil society organizations in Southern Africa to implement policies and health services for those infected with or affected by HIV and AIDS. This six-part web series broadly aims to strengthen the monitoring and evaluation or M&E capacity of organizations by providing guidance on the key components of M&E systems that will enable them to effectively monitor and evaluate their services in accordance with international best practice. Your organization is now working in a results-driven environment. M&E can assist your organization and other stakeholders to respond to the following considerations. Has the project performed or achieved its purpose or goal? Was the project effective? How were resources spent? Should the project continue as planned, or is there a need to change anything? What funding is needed for further support for this project, and why? How can you prove or determine the success or failure of a project and provide justification for further funding? What information would you need in order to convince you to donate to your project? Through M&E, we're able to identify strengths, weaknesses, opportunities, and threats faced by your organization and how these can be addressed or leveraged. We're able to identify and document implementation challenges, consider lessons learned, and provide good practices. This training series presents various areas of focus in M&E as separate but complementary and interrelated modules. Together, they form the minimal set of processes that underpin the various stages of a project cycle, enabling us to plan, implement, measure, evaluate, learn, and exercise the highest levels of accountability to our development partners, beneficiaries, and other stakeholders. The modules are designed to follow a logical sequence that will enable you to build the necessary frameworks for your organization to systematically and effectively monitor, evaluate, and communicate the results of its work on the ground. While the trainings can be independently utilized, we recommend that you start with Module 1 and follow the sequence to the end to ensure that you benefit from the live weekly Q&A sessions on the e-forum, where real-time facilitated thematic discussion forums will be held to engage with peers and consolidate learning. Module 1. Introduction to Results-Based Management and Development of a Results Framework. Module 2. Selection and Definition of Indicators. Module 3. Development of a Performance Monitoring Plan. Module 4. Planning for and Assessing Data Quality. Module 5. Program Evaluation. Module 6. Communication. The modules presented will orient you on the multiple complementary components of M&E, which fit together like puzzle pieces to present a comprehensive big picture. And the big picture is your organization's journey towards contributing to social transformation. By the end of the course, you will have an understanding of the linkages between the various elements of M&E and how they provide you with a structured, organized, and coherent way to achieve your organizational purpose while maintaining accountability to your stakeholders, including the beneficiaries of your programs and the donors who provide the resources for you to implement them. The course will help you to start thinking through the key elements of your M&E plan. The M&E plan is a living document that should be developed in consultation with your implementation staff and other stakeholders. The document should present your results framework with narratives describing your strategic objectives and various levels of expected results, as well as strategies for achieving the results. There should be a table of all the indicators linked to the results framework, as well as indicator reference sheets for all the indicators. From the outset, There needs to be a plan for the assurance and assessment of data quality, included along with a tool for assessing data quality, as well as a plan for when and how program evaluation will be carried out. It is also important for the plan to articulate all the staff who are involved in M&E, both internal and external, as well as what their roles are. After completing this course, you are encouraged to prioritize the development of a results framework if you do not already have one. It may need review and revision as the organization learns from implementation or as conditions change. However, it is an essential starting point in the context of results-based management. Select indicators to measure your results and develop a performance management plan to regularly monitor these indicators. Data tools that provide data in a manner which can be utilized to measure the indicators need to be developed and disseminated to sites where implementation occurs in order for regular collection of data to occur as part of a routine program monitoring system. There is need to provide capacity and support to all staff who are involved in the various stages of M&E, from management through to implementation of programs, as well as this ensures that sound processes are followed, real learning occurs, and quality is maintained. Return to the main menu to begin this course. We hope you benefit from the course and welcome your feedback.